Hello and welcome to Health 360, a production of SEL Health where our mission is you. I'm Angela Douglas Babcock, and during our time together today, you'll be hearing from some of our physicians who will offer you tips about how to make healthy back-to-school choices so your family can live their best, most balanced life. Our topics today include an update about COVID-19 from Dr. Michael Bush, a longtime Billings emergency physician and currently the Chief Medical Officer at Holy Rosary Healthcare. He'll be talking about how the latest surges could impact the school year. And we'll be joined by Dr. Stephanie Thomas, a primary care physician at our SEL Health Medical Group Clinic in the Billings Heights. She'll shed some light on vaccinations and steps you can take to keep your kiddos as healthy as possible this year. Then we'll round out today's webinar with tips about how to ensure your kids have a happy school year from Dr. Colette Chorney, a pediatrician at SEL Health Medical Group in Butte. All right, it's no secret that the number of diagnosed COVID-19 cases is on the rise again, and there is great concern about the Delta variant and what all of this means as we head into the fall season. Hi, Dr. Bush. Taking a look at this school year, how are things different this year compared to last?
We do know that we are seeing predominantly the Delta variant in the COVID virus as the primary source of infection today in Yellowstone County. We know that the Delta variant, as opposed to the variants that we had in our previous surge, has a greater prevalence of causing illness in the pediatric population. We do not believe that that illness is any more likely than previous illnesses to cause serious illness requiring hospitalization or intensive care. But we do know that that is still happening at the same rate that we were seeing with pediatric illnesses in 2020.
How does the Delta variant differ from previous strains?
We know that as compared to last year, the Delta variant is more likely to cause illness in children. We do not believe that the rate of serious illness in children will be any different this year with the Delta variant than it was last year. But there may be more cases because there are more people getting sick with the Delta variant. We also know that because of the way the Delta variant acts, people will get sick sooner than what they did with the previous episodes of the virus, meaning that last year we expected after exposure it to be 3 to 5 days before you develop symptoms. Today we're looking at 1, maybe 3 days at the outset to develop symptoms from the point of exposure.
Dr. Bush, is there anything else you think parents should know heading into this school year?
So I know that these are really challenging times, very concerning and scary in all reality. And we know that our kids potentially could get sick and have serious illness. But all we can do is try to raise our kids the best way we know how, support our kids to the best of our ability, and just use our best judgment as we go forward. Again, would encourage you to use all the protective measures that you could reasonably use to help maintain the health of your children and your family. And I wish you the best this upcoming school year.
While the world focuses on critically important new vaccines to protect against COVID-19, there is still a need to ensure routine vaccinations are not missed. In addition to the COVID-19 vaccine, there are a lot of questions about vaccines in general, and a lot of kids have not been vaccinated during the global pandemic, leaving them at risk of serious diseases like measles and polio. And on top of that, there is a lot of misinformation circulating on the topic of vaccination, and that adds to this threat. Joining us now is Dr. Stephanie Thomas, a primary care physician at our SEL Health Medical Group Clinic in the Billings Heights. Let's first talk about the COVID vaccine. How safe is it for kids age 12 and over?
Right now, the vaccine that's approved is the Pfizer vaccine for teenagers 12 and up. So all adults, all kids 12 and up. The safety data that they've gathered over the last about a year and a month. I think they really started trials about July last year. The safety data has actually been very good. We've got about 1 in a million serious reactions that happen usually within the first 15 to 30 minutes after the vaccine. It's very, very low. We have not found any significant risks. Some of the things that have been in the news recently were things like association with myocarditis. They found that there were, I think, somewhere around 240 of all ages, and about 80 of those were in kids between the ages of 12 and 18. And they've really found that that is very minimal. I think there were about 80 of those out of that whole 240, and most of those cases were very limited. And actually the risk from the virus itself, so actually getting COVID, the risk of having that complication, which is inflammation of the heart muscle, myocarditis, is actually much higher in those who get the COVID virus versus those who had it after the vaccine. And we think that some of that is just when the immune system activates and does its thing, it can cause inflammation. That's how it works, to trigger your immune system. But as a side effect, very rarely you can get kind of these downstream effects. But they've really found that it is a safe vaccination.
What can parents do to keep their kids safe if they can't be vaccinated for COVID yet?
The best ways that we can help protect them is to, one, have anyone else who is in their life around them be vaccinated. So that's parents, that's grandparents, that's older siblings, that's cousins, that's teachers, anyone who is going to be around those children who can't yet get the vaccine. By us around them being vaccinated, we are protecting them because we're less likely to carry the virus to them. The other things that we can do, which, we really have seen over the last year that have been effective, are things like social distancing. So limiting time spent in crowds, limiting time around those people that are not in your immediate household, doing things like wearing masks, washing hands, which honestly, we should all be washing our hands very frequently. I think we just got reminded of how important that is over this last year.
COVID-19 aside, are there any misconceptions about childhood vaccinations that you would like to address?
When you get into concerns about vaccinations as a whole, there are a lot of anecdotal stories that say, so-and-so got this vaccine and they had this bad outcome, or it affected. I think a big topic that scares a lot of parents is when people throw out the term of fertility. So looking at having my kids be able to have kids down the road. And really the research has shown time and time again that there really is no correlation there. And that unfortunately has also been thrown out when we look at the COVID vaccine. And, the data is it's just not there. But hearing those things, it is scary when you look at how, parents are making decisions for their children and they just want to do the right thing. And that's not always easy to know exactly what the right thing is. However, the data and the safety profiles of the vaccinations that we do give regularly is there, and we're always monitoring. We're continuing to gather data and make sure that these are safe.
Are there any symptoms specific to kids that parents should be aware of and keeping an eye out for?
Some people, specifically kids, have mild to little symptoms, and some have severe symptoms. So, the traditional ones: fever, severe fatigue, headache, sore throat, runny nose, loss of taste and smell is almost diagnostic of COVID specifically. But other people have symptoms similar to seasonal allergies. And right now it's really hard. We've got a lot of smoke in the air. People are having asthma. They're having allergies that they've never had before. And so it's very difficult to discern which one is what. Is it just allergies, or could it be COVID? And so other people have vomiting, diarrhea, tummy aches. And so it just becomes important for all of us, is that if your child is exhibiting symptoms that are different from them, if there's been a change, specifically an acute change, if they've, if all of a sudden they're really tired and they just don't feel good and they're running a fever, if they've got the sniffles, get them tested. Because even though they have mild disease, or maybe it's just allergies, maybe it's a different virus, because COVID, specifically the Delta variant, which is coming through, it is here, it is so much more contagious than the original version of COVID was. And it is so much more contagious than most of our respiratory viruses that we usually get every year. It is important to help contain by getting them tested early. Getting them tested, make sure that it's negative, masking if they're around other people to prevent any spread while we're waiting for those results. I think specifically for medical providers like myself, I think the biggest thing that we caution people is we would rather test and have it be negative than not test at all and have a larger outbreak that could have been potentially prevented.
Is there anything else you think parents should keep in mind heading into the school year?
I think the biggest message that I want to send to parents, and this includes friends and family, myself included, we're all trying to do what's best for our kids. And sometimes it's difficult because as we go on in the process, the recommendations change. This virus has changed. What we thought was true last month is different this month. What we know this month is going to be different than next month. And so, I just encourage people to seek out those reputable sources. Ask your physician, people that you trust, not necessarily the YouTube sensations, not necessarily, this one story on Facebook. Like, really reach out to those people that you trust. If you trust us enough to bring your children to us to take and keep them healthy, trust us when we give recommendations. Trust us when we say we're learning. We don't know everything now. And what we think today may be different than tomorrow. And we're going with the flow. We're learning as we go. And that's the scientific process. And so while it seems like we've flip-flopped on our recommendations back and forth, it's because we're learning. This virus is changing. We're learning as we go. And that's how science works, is we learn from our mistakes, we learn from what happened before, and we try to do better next time. And so the recommendations will change as this virus changes. And it's not that we were wrong, it's that we were doing the best with the information we had at the time. And so the biggest thing that I can say is, if we feel confident, and the one thing that I say to myself when I recommend anything for my patients is, would I do this for my family? Would I do this for my child? And specifically with the COVID vaccine, if my child was old enough to get it right now, he would have it. He would be getting it. He's not yet, and hopefully that will be coming soon. But if my child was eligible, they would be getting the vaccine.
Last school year was unlike any other. Many of our students spent part or most of the year learning remotely. After months physically away from teachers, classmates, and a traditional school day structure, some kids may feel a little out of practice when it comes to tackling the start of a normal school year this fall. Joining us now is Dr. Colette Chorney, a pediatrician at SEL Health Medical Group in Butte. Hi, Dr. Chorney. Let's dive right in. How many kids on average face some sort of anxiety regarding school?
When we think about kids who experience anxiety in general, I would say that according to the National Institute of Mental Health, about 30% of kids will have some anxiety at some point within their sort of childhood or adolescence. But that's not necessarily school-related anxiety. About 5% of kids will have more severe anxiety related to school that leads to some sort of school-avoidant behaviors. But only a small percentage of kids really have some of that significant stress related to school, but a lot of kids have some of those mild back to school worries and anxieties that subside once the school year starts.
What can a return to school do mentally to students after an extended break?
It's a big change in schedules for many children, for sure. They're switching from a less structured summer to a much more structured school year. Like I had alluded to before, it does cause some of those stress and worries. And also this year, some kids may be switching from distance learning back to in-person learning as well, which could be a big transition for them. Overall, I think though going back to school is a great thing for kids, once they get through that transition period. Kids really thrive on a schedule, and the school year typically provides that structure along with more peer interaction and learning. So it's a really exciting time for them too.
What can parents do to help relieve these feelings, and how can they start the conversation?
Parents or their guardians can start that conversation by just checking in and seeing how their child's feeling. Many kids will have some sort of mixed emotions about getting back to school. They can be both excited and nervous at the same time. Parents can ask, are there specific worries that you have? Maybe that's meeting a new teacher, being able to see friends, kind of knowing where their school is or what that's like, especially if it's a new school for them. So this kind of provides, a way for parents to kind of get some insight into what their child's thinking, and then help to address those specific worries, help to reassure kids and find ways that they can make that transition easier for them.
Do you have any tips and tricks you would recommend for students and kiddos?
I think starting school schedules early in terms of switching from, say, new bedtimes and wake-up times, that always makes that transition easier. As I mentioned before, talking about school, being very positive about it, modeling that school is a good experience overall can help kids to perceive it that way as well. And then find something that they're excited about in terms of starting school. Maybe that's seeing friends, starting up in sports again, a class they're especially excited to take. And focus some of the conversations on that. And then I think that they could really have something to look forward to in trying to start school. Just try to highlight the positives and look on the bright side of things.
I'd like to thank all three of our guests for providing such helpful information today as we all embark on a new school year. And thank you for joining us for this edition of Health 360. Get tips to help you make healthy choices and live your best, most balanced life by signing up for our Health 360 newsletter. Just go to selhealth.org, and please feel free to share this webinar with your family and friends. And remember, at SEL Health, our mission is you.